True or false? If you get a skin wound, the first thing you should do is clean the wound with either hydrogen peroxide, like this, or rubbing alcohol. What do you say? Is that true or is that false? Guys, I'm Dr. Jen Caudle. I'm a practicing family physician and on-air health expert and video creator. We are talking about this because I'm in the office today and I have seen a lot of things I wanted to talk about regarding wound care and hydrogen peroxide and rubbing alcohol. And I am a child of the 70s, and I remember when I would go out and scrape up my knee on the playground or in the driveway or whatever. I would have my wounds cleaned out either with hydrogen peroxide or maybe some rubbing alcohol, which I think a lot of us did. So, is that what we should be doing? Well, I'm going to give you the answer right now. First of all, it is true that hydrogen peroxide and rubbing alcohol are antiseptics, which means they kill germs, and that's where a lot of us got the idea from, our parents, etc. But the truth of the matter is that hydrogen peroxide and rubbing alcohol can actually harm the surrounding tissue of the wound. Believe it or not, yeah, you know how sometimes it burns? Well, you know what? It can actually harm the tissue of the wound. Not only that, one of the biggest problems with that is it can delay the healing of the wound. So even though we think we're killing the germs, which, by the way, might be happening because we know that these are antiseptics, very likely, even more so, they're actually delaying wound healing or the closure, etc. of the wound. Also, we know that hydrogen peroxide and rubbing alcohol on an open wound can be quite irritating. And the way that the wound healing is actually delayed, right, is that the rubbing alcohol, the hydrogen peroxide, while it's an antiseptic and might kill germs, it also can destroy healthy cells, which is really not what we want. So, I mean, guys, the idea is, believe it or not, stay away from the hydrogen peroxide and the alcohol, the rubbing alcohol, when it comes to superficial skin wounds in general. You say, well, Dr. Jen, what should I be doing? Well, obviously, I want you to be checking with your doctor because every wound is a little bit different, but we usually say the old go-to of some good old soap and water is a great way to sort of wash out debris and germs and kind of keep a wound clean. Now, if you got stuff stuck in your wound, okay, you can get a pair of tweezers that have been cleaned with rubbing alcohol. The tweezers cleaned with rubbing alcohol. You can pull out if there's grass or if there's like little splinters or whatever, you can pull that out. But then, of course, you want to wash the wound, not wash the wound with water and soap. That's really, really important. So guys, keep this in mind and please pass this on. I'll tell you why, because a lot of people will come into our office, recently, in fact, with me as I'm in the office today, and they will have had a wound and they clean it with hydrogen peroxide or rubbing alcohol thinking that they're doing a good thing. And yes, while it's an antiseptic that kills germs, it also may be killing healthy cells and delaying the healing of the wound, actually keeping it from healing as nicely and as well. So that's super important. Please pass this on to other people because there are lots of folks out there using hydrogen peroxide and rubbing alcohol to clean the wounds, and that's not what we want. And of course, above all, you check with your doctor with any wound that you have. You can call them and say, Dr. such and such, this lady named Dr. Jen on the Googler Schmoogler said not to use rubbing alcohol or hydrogen peroxide. Just check with your doctor. But anyway, guys, I hope this is helpful. Guys, I'm Dr. Jen Caudle, a practicing family physician. If you've not subscribed to my channel and clicked the little bell, please do so. I appreciate your comments and please share this video with other people. Guys, I'll be back soon.